Ask any medical marketer, and they'll tell you it's a busy time of year for conferences. Super busy, some might say. Last week, we looked ahead to Cannes, and this week, we're previewing the American Society of Clinical Oncology's annual meeting. Just remember, whether you're heading to the sunny south of France or Chi-Town on the cusp of summer, we've got you covered. ASCO is the preeminent cancer conference, bringing every oncology stakeholder to Chicago for a weekend of breakthrough presentations, pertinent health discussions, and a bevy of brand activations. Additionally, MM+M will be on the ground there, represented by pharma editor Lesha Bushak. Ahead of ASCO, Lesha chatted with Illinois Cancer Care's Kimberly Ku, MD. A triple board-certified physician, Ku recently partnered with Cancer Therapy Advisor, a fellow Haymarket Media brand, to distribute her podcast, Value-Based Care. Now she's joining us for a podcast to preview ASCO, as well as to offer insights on how pharma brands can better message to HCPs and patients about cancer care. After that, I'm shipping up to Boston for the Veeva Commercial Summit. So you'll hear from the rest of our team during Trends, where they'll be trying out some of the video games that were submitted for the 2026 MM+M Agency 100.
Kim, thanks so much for joining.
Oh, thank you for having me.
So to start, can you give our listeners just a little bit about your background and what you'll be doing at ASCO this year?
Yeah. I'm a community medical oncologist, hematologist, so I see all sorts of disease types. I'm also part of the U.S. Oncology Network. And so going to ASCO is always such a great opportunity to see what everybody's doing. It's also really important to think, for me, beyond the sciences and also the communication skills. And so I'm going to be part of the ASCO Leadership Development Program, where we'll be talking about, for my project, restoring trust in medicine. And so that's a very key part alongside all of these very important medicines and precision medicine that we're doing.
Yeah, that's a really important topic that's been super top of mind for healthcare and pharma marketers. Most of my interviews with marketers in this space has been around how do we rebuild trust among consumers kind of in this polarized and politicized era of science. So happy to dive into that with you. But you've been going to ASCO for like a decade or something, so you kind of know what to expect, but you've also probably seen the changes over the years. And I assume every year kind of has like a headline technology or science, like there's CAR-T or oncology. Is there a leading theme or kind of like, headline tech this year that you're keeping an eye on? And if so, what does that look like?
I always look at the presidential theme, and I try to think about what that theme is drawing from. And so this year's theme from Dr. Eric Small has to do with the globalization of oncology, of being able to treat everybody. And I think a lot of the presidential themes share in that. But what's unique about this year's, I think there's going to be a lot more talk of course, artificial intelligence and how that's going to help with reaching to more patients and being able to increase access and equitable care. I think also the idea of the precision medicine, which is how do we target the biology better? I think that's going to be increasingly emphasized. It's very much something that's thematic in a lot of the ASCO meetings, but even more so this year just because of some really interesting RAS inhibitors and how we've had 40 years of calling it an undruggable mutation. And now we've got 50 plus drugs in the space that are being experimented. And so there's a lot of excitement about the medicines themselves, and then also the thinking around, in general, targeted therapies, like introducing in neoadjuvant, adjuvant spaces, taking from metastatic, moving to earlier in the curative intent, and even taking medicines that were meant for one type of cancer and then trying it in another type of cancer.
So a lot of exciting stuff. And I was kind of reading a little bit about the ASCO theme as well, of this idea of like translating the science and the practice and really bringing these kind of like breakthrough science and high-tech innovations onto, like, basically into hospitals on the ground, especially in communities that might be low resource settings. What role do you think that, like, marketers and healthcare communicators play in that process? Most of our audience are marketers, and, what role do you think that they play, and how can they kind of help that along?
Yeah. And I look at going back to the restoring of trust. Mm-hmm. I look at that as very much there's the provider and the patient, that's kind of like the kernel. And then there's so many things, so many layers around that to help bolster the trust. And I like using this term trust brokering, which is trying to find common ground, and any of the many stakeholders who are interested in aligning with common ground. And so patients with their doctor, the doctor that they call their own, there's this inherent relationship and expectation already that my doctor is going to be able to tell me something that I can trust them, that they're going to be having my best interests at heart. And of course, there's the feelings of that trust breaking, but that's harder compared to trust in, like, let's say a big institution mm-hmm. or a company. That kind of trust is not so personal as that doctor and the patient together. So being able to lean into helping that relationship. And so for marketers, I think there's a little bit of being fair to all of the 360 sides of that story. So there's folks who feel like we need all the innovations that come from marketing new drugs. And then there's also the spectrum of, well, how are we navigating things like conflict of interest? And if we're trying to get new drugs out, is that really what's best for patients, or is that really best for the marketers? So I think being very transparent about what it is that we're trying to achieve. And sometimes we can achieve more than one thing at the same time and still have it be, maybe it's not black and white, but it's at least the truth. And so I look at it like being able to help that relationship between the patient, the doctor, and helping the clinic, the staff, anything that is helpful for that microenvironment, that community. And then acknowledging, yes, it is part of a greater environment of getting medicines out, but it's an agreement of, well, is this really first and foremost helping that patient, that healthy, multi-layer trust common ground? Is that doing that first? And then a lot of the other things, I think it's, there's always going to be people saying how they feel about their side of it. And that's part of the trust as well, is recognizing that everybody's got their point of view, and we're more about trying to understand and be curious and ask questions.
Mm-hmm. And been hearing from people in the industry that pharma brands are increasingly spending more and investing more in ASCO and kind of being present at ASCO and getting in front of a lot of the HCPs and the researchers and scientists who will be present there. And the competition is also getting a lot fiercer among, oncology products and oncology leaders. As a physician yourself, kind of based on everything you just talked about, how do you feel about, pharma brands kind of increasingly investing in being present at ASCO, and what do you think that they can do to kind of keep a physician's attention, or sort of maybe build that trust or stand out among all of the other vendors present?
Yeah, it definitely goes back to, and I feel like I make it sound so simple when I say it just comes back to the patient.
Yeah.
But I think, patients, they're watching, and they can tell when something feels like it's meant just to be another commercial, or meant to sort of like take advantage of them. So I think they have their own feelings about it. But when they can see that there's a relationship that's truly trying to be helpful for their overall health, and that their provider is saying that. That's why it's so important that we protect this idea of the physicians are truly taking care of their patients, because they really trust that our conflicts of interest are resolved. And in any being completely transparent of all our conflicts, there's probably going to be some biases pulling back and forth. If there's anything that we get paid for, I think it's really hard to separate that completely and say, oh, there's really no conflict at all. But it's more about, I think, having that very clear declaration and management of perception, where it's like, I'm not doing something because I don't want to be perceived a certain way, but I truly am doing this because I think it's going to be helpful for patients. And so I don't inherently look at things like pharma at ASCO as a good or a bad. I think there's a lot of very complicated pressures that are resulting in that. And we see that play out in medical oncology too, where we've got the different ways of being able to take care of patients. We've got hospital systems and the way that they're evolving, like consolidating, becoming bigger. We see things like community oncology, like independent practices, and how they're becoming bigger in terms of engaging in network systems. And then there's all sorts of government pressures there too, things like Medicare and payers. And so I look at it like it's not so simple as to say if pharmacy comes to ASCO that's a good or a bad thing. I look at it like there's a very complicated environment, but as long as we're thinking that this is part of us trying to help our patients, and what are those problems that we're trying to help them with, things like how do they get the medicines they need, like access? Are the pharmaceutical companies helping us to problem solve that? If they're helping us with access, then I'm not really thinking so much about, oh, is this company like a good or bad company? I'm thinking, well, they're trying to help the patient care. And same thing with marketing. If it's meant to be like, hey, here's something, but we really want you to talk to your doctor and we really want you to get informed, and here are some really reliable resources, then I think of that more along the lines of education and more trying to help people think, help people be responsible, as opposed to, oh, I know what makes you want to tag on to something, and then I'm going to take advantage of that nervous system wiring. Like that part is the part of marketing that I think there may be that cynicism or that connotation, but probably not really the intention, or at least we don't have to use it with that intention. Mm-hmm. So my very long way of saying I'm very okay with a lot of things that just come down to, if someone's trying to help me take care of patients, I think patients and doctors, they're going to ultimately, maybe not immediately, but eventually they're going to catch on and they're going to know, is this really helping that trusting relationship, or is this more serving something else? So I think what I'm seeing is more of trying to get that level, that rebuilding of trust, where we can start to see that patients they're doing things that are serving them. Like that's where things like misinformation come out, or like holistic medicines, or they're trying to get their own answers.
Right.
So a lot of what we're seeing, I think of it like it's trying to rebalance the trust, and it's kind of like screaming out, hey, can't we just get back to where we were before, where we could just sit with each other and talk and not feel like misunderstood or talking over each other. So I feel like I could keep going on and on, and it's you're like super kindly humoring my stream of consciousness.
Well, no, it's such an important topic. I mean, we just recorded a podcast episode earlier today about like the hantavirus and all the misinformation going on around that. And this idea of like, what happened why is the public not trusting science anymore? Like, what happened to break that trust, and how do you restore it? Kind of in a broader sense beyond pharma industry and pharma marketing. And it is just like a topic that I think is like really, really relevant right now. So do you expect to kind of hear a lot of conversations around this at ASCO this year? Do you think it's going to be sort of like top of mind for oncologists? And, you know, when it comes to like, how do we restore public trust in the science?
It's probably one of those type of conversations where it may not be addressed head on in that way, but it may be coming in the form of, like, for example, when you mentioned the hantavirus. So it may be more like these breaking news type of stories, like, oh, have you heard of what's going on with this? And what do you think about it? And what I would challenge all of us as oncologists is it's more of taking a moment to examine what we're about to say and think, why do I feel like I need to say this? Like, is this really, truly what I think? What am I really saying that is my own thought level? The reason I say that is I think it's really, there's a lot of pressure to not create political charge, but at the same time,
right,
it can be for some folks who, if they have some type of a goal in mind, it's really easy to get that goal achieved by trying to be sensationalist about it, because that's kind of the easiest way to achieve significance. So being able to be safeguarding our own thought process, and if we find that we're really feeling very strongly about one stance or another, I think being able to say, why do I feel so strongly about this? Like, even as you were asking me about the pharmaceutical companies at ASCO, I was thinking, well, there's probably going to be people who don't mind at all and people who mind a lot. And I'm thinking to myself, well, what do I really think? What do I think about it? And I'm pretty much of like an early adopter, enterprising person, where I don't feel like this is a pharmaceutical versus medical, even giving it labels per se, but more of when someone wants to sell a drug and they're paying a lot of money to go somewhere where prescribers are going to sell it. On the one hand, that may sound not so great, but how else are they going to try to help introduce a drug if there's actually viable data around it? And yes, there's a lot of layers around that. Like, why is it that study got funded and not some other study? Why are we paying attention to this kind of thought process of doing these kind of clinical trials around drugs and not around things that are less profitable? Those are all very important perspectives to take on too. But I think being able to have actual discussions around these points and not immediately jump to, well, a judgment or criticism or a kind of like a foregone thought.
Mm-hmm. Yeah, I think that those are all really important things to keep in mind, because it is sort of a complex area.
Yes.
And in terms of like the science and the data that you're excited to see, you know, unveiled at ASCO, I know you mentioned at the start a little bit of what you're excited about, but are there any like presentations or data that you're like really going to be paying attention to that you think is going to be super important this year?
Yeah, I think a lot of times the cancer doctors who go to ASCO, we really take the opportunity to just even reconnect. And of course, the studies are very important. And I think a lot of times we go to those studies where we're supporting a larger network that we're even part of. And so I think some of the studies that are really big include the ones that have to do with, for example, the Resolute study that has to do with RAS inhibitor and pancreatic cancer. Mm-hmm. There's also a new drug in non-small cell lung cancer, selpercatinib, that new in the sense that we use it in metastatic setting, and now we're trying to see, can we move it up into earlier stage adjuvant setting? And then there's revisiting the idea of neoadjuvant and adjuvant in prostate cancer, whereas a lot of times we're looking at adjuvant in prostate cancer, and then other cancers we're already doing neoadjuvant, but in prostate, this is something that's been sort of like late entry. So I think a lot of the targeted drugs, the androgen receptor antagonists in prostate cancer, looking at that neoadjuvantly. So there's a lot of room for precision medicine this year, and there's always going to be expanding room in that. But I think also what's really interesting is, while seeing that there's this increasing marketplace, there's also that groundedness of how are we making sure that we're doing all of this in a way that is honoring that trusting bond. How are we going back to the communications aspect of it? Like, we aren't really wanting patients to look at this like this is something that they're buying at a marketplace, but this is more, is it really good for their health? Is it really in their best interest? And they're going to want to hear that from their doctors. And then finally, I really like the idea of those kinds of visits or those kinds of sessions where it's paradoxically, it's not about the medicine, but it's the therapeutic delivery of communication. And so, for example, I'm really interested. There's a meeting of Dr. Eric Small is going to be talking with David Kessler, who's a grief expert. So I think that type of conversation is very interesting because we don't really get a lot of that exposure. Mm-hmm. And by being able to better grasp these kinds of challenging conversations, I think then we're going to be more convincingly able to give medicines that are therapeutically helpful for patients.
And what role do you think AI is going to play in all of this? Because that's been a big buzzword the last couple of years in medicine.
Yeah. And AI, everyone's on their different spectrum of that as well, where some, I think I'm more early adopting and I look at it like it's an opportunity to learn medicine anew. It's kind of like being a child at a playground, and this is that opportunity to go back to being a child and to actually just truly play. But I know I also can respect that side of looking at it like, well, why are we doing this? And there's a lot of room for waiting and holding off. And I can see that whole spectrum. And then there's a lot of folks in the middle. But I think when it comes to being able to take care of patients, going back to that trust aspect, there's just so many things that a provider gets pulled in a lot of directions. And I think AI has that opportunity to clear out the things that can be automated that aren't really a truly helpful trust building medical provider role. Like, I'm always going to very much appreciate someone who can help me with scheduling, or someone who can help me with triaging, or someone who can take orders or do scribe work, or and now we can offload that off of someone and put it on AI, because even for a person to do a lot of those jobs, it's very hard on them too, because it's automated work. So it's very hard to reduce a creative person down to these kinds of more rote jobs. So I look at it like an opportunity to free us up to do that trust rebuilding and repair. And then also to be actually maybe not convenient, but to be even more discerning about our medicines and have those honest conversations with patients who want to explore the alternative medicines or the non-medical things, like they just want acupuncture or exercise or meditation. I think AI is going to be able to help us better explore that knowledge base and not look at patients and say, oh, well, I was trained a certain way, so I don't know. Now we can actually have conversations around, well, let's look up what do we as the human collective know, and let's share how do we feel about this. I think that's a little bit more of a longer, more complicated conversation, but AI, if it can take off all of that stuff that gets put into the day-to-day clinic, that reduces down the actual time that we spend with patients, where it feels like we get a 15-minute slot and all of it is like billing and scheduling and scribing, and then you get really 2 minutes to talk to a human being. And now we're going back to, no, we can take the full 15 minutes to talk with the person. I mean, now we can actually spend longer time even. And so that would be what I feel like AI is truly interesting to me as a community oncologist, is how do I responsibly automate? And then how do we have those really intricate conversations about the science part of it, where we're being very responsible? Because admittedly, as a community oncologist, I'm not a subspecialist in just one area, but I also am thinking that AI can almost be like that consultant of that subspecialist, where you can start to leverage that knowledge a lot more freely because it's so accessible.
So sort of the opposite of the fear that AI will replace all humans, you're hoping that it will be an automation that allows more human interaction, hopefully, between the physician and the patient.
Yeah, I find it, and I do get this question. Sometimes patients kind of joke and they say, what's going to happen when AI takes over? But if you really think about how would AI take over, like how would a patient go to clinic and then there would be a screen or like a holograph and it just starts saying, oh, this is what we're going to do. Like, I just wonder how could that even happen without a human being? And how would a patient actually feel like they get that trust that is very biologically driven by being able to sit with another living, breathing human and read your body language and the eye contact and get that oxytocin and that dopamine. Yeah. Like it doesn't feel the same. In fact, I think that's part of this increasingly digital world where we have a lot of social media, which is great. I mean, obviously I love social media, but also that increasing lonely feeling, because then people start to feel like, is the person in the room really there with me? Because they're scrolling on their phone or they're like thinking about something else. And so I think that connection piece will always be irreplaceable. And we might even have a period where we think we can replace it. And then we'll start to realize the breakdown and go, oh no, we need to
go back to
the person. And then we'll also realize that the AI needs a real person for it to work because it's a reflection of us. It can do a lot of things in a more intelligent way than us, but it can't have things like core values. It can't really have things like morality. Like, if you build an AI in a way where you're saying, I want it to be more empathetic and I want it to give honest answers and I want it to look at words and actions meeting. Like if you start telling AI to do that, then it takes direction from you, but it's not going to automatically assume a personality like that. And so I would actually think AI without humans, we're going to be feeling a very big difference. Our intuition, I feel like it is the human, not artificial intelligence, but like the actual intelligence, the real supercomputer that we were gifted with. And AI is very good at simulating it and kind of showing us that, but it really came from us, like that empathy part. So I just don't see a world where it would ever make sense that we got replaced or we would actually get asked to get put back in.
Yeah. Well, it comes to that full circle moment of rebuilding the trust, and it all comes down to trust, right? And having that like human interaction in person, like you mentioned, that's irreplaceable. Is there anything that you think just in terms of like logistical things going to ASCO or like, how do you network best? Any tips or advice for people who are attending ASCO? Maybe it's their first time, maybe it's their 10th time, but like anything that you kind of keep in mind when you go and you're there on the ground?
Yeah. And speaking from my own experiences and more so learning from mistakes. So I think when I first went to ASCO, I was very planned out about it. I was like, I'm going to mark these presentations and I'm going to only go to those. And I'm going to fit in my itinerary. But I think the really surprising organic things that you don't expect are really what's magical about ASCO. So Haymarket itself is an act of serendipity where I was actually meeting someone and I wasn't even sure like if we're going to meet. We just had our cell phones and we're like, oh, did you want to meet for coffee? And then this person from Haymarket was like, oh, by the way, I want you to meet our leader. And do you want to do that? And I'm like, sure. And I don't think I would have done that my first time around because I would have been looking at my watch and being like, oh, but I got to get to this like session that is so important. And it's only important because I told myself it's important, but really you're going to be able to get the publications later and you're going to get like a best of ASCO later anyway. So I think it's more that really amazing letting people come together and then see that magical thing that happens when real people just run into each other and then all that real stuff.
Yeah.
Like,
yeah. And so stay open to those sort of organic meetings and the serendipitous things instead of having the whole schedule planned out because it might be overwhelming.
And it's really hard to do, very hard, especially because when I went to ASCO and my kids were really, really tiny and I would be rushing to, which by the way, ASCO has done this really cool childcare program and I'd be rushing like, oh, I got to get them over to the childcare and then I got to pick them up. And so sometimes it can't always be 100% organic and that's okay too. Like I don't want to go the other direction and be like, oh my gosh, I'm not being spontaneous enough. But have to balance the realities of life. But that's the thing. What I loved about ASCO is anything a given year I didn't feel like worked out, then I would just try it differently the next year. Like I used to rush and take my kids and now I look at it like, well, actually, I'm just going to go by myself because my kids are older and don't really need me either. So then I can really enhance that organic aspect. And also my kids don't really feel like they have to do childcare and they can have their own life and do sports and do camp. And so I think of it like it's iterations and growing, just mirroring like anything else in life.
Yeah. For sure. I mean, I'm very excited. This is my first year going, so I'm excited to go and hopefully experience a few of those organic interactions and see what sort of the big conversations will be this year. And I'm sure a lot of it will come down to trust. But Kim, thank you so much for joining and sharing your thoughts on ASCO.
Thank you so much.
And now we have our trend segment, and we are here with Steve and Bella. Jack is not here today, but the three of us are going to discuss the biggest trends that we've noticed when we've been doing our Agency 100 interviews. Most of our stories are in at this point, so I think the three of us can talk about some of the most interesting things that we heard in our interviews and the biggest trends that we've been seeing. Steve, I'm curious if you've done a lot of work about AI and interesting AI tools in the industry. And AI, I think, is a big trend that I saw in a lot of my interviews. Did you see anything noteworthy in terms of like new AI capabilities or trends in your interviews?
Well, I mean, anytime we have a discussion about pretty much anything these days, it turns into a discussion about AI because its influence is so strong and to a certain extent rampant, right? Everybody was talking about it. Everybody says they're on top of it. Everybody says they have unique tools. But when I kind of think about, I did 10 interviews for 10 profiles. And when I think about the sum of what I saw and heard, I don't mean to be alarmist, but I think that the Agency 100 5 years from now has the potential to be the Agency 50, because AI is becoming so strong, so fast, that much of the work that's being done is something that, would be able to be done by AI. And so just sort of the market would dictate that agencies roll up into each other. So I know it sounds dire, but that's really the impression I was left with.
I think just sort of go off of that. That was a topic, probably the biggest topic in all of the profiles interviews I did as well. But what I heard a couple agency folks say is that they think it would be detrimental to focus on just how AI creates efficiencies at this point, because that's sort of like the bare minimum. Brands aren't looking for, they of course are looking for efficiencies, but it's more so how, it can be used as a creative partner and be used as a we've heard people talk about turning an AI into a colleague or a, sort of sparring idea wise. There's a lot of talk about using it to disqualify bad ideas faster. And so, I feel like a lot of our conversations, because I was really like that too. I was like, not to be, doom and gloom about the role of agencies, but it's definitely something we've heard at conferences and, in coverage and stuff recently. And that's sort of where I would say the general vibe of these agencies is that they're trying to, really, really say to brands, like, we can be your sort of guide in this and use the tool as a partner, not as a sole replacement.
Yeah, I mean, I think like the replacement versus the human is still needed thing. I mean, I was hearing a lot from agencies that they were really emphasizing more than in years past that, like, oh, the human is still really, really necessary in all of this. And consumers crave that like human interaction and that human touch throughout all of the marketing processes in healthcare. But Steve, you still think that AI will kind of like lead to a diminishing of work or like kind of that human?
No, I don't think it. I agree with you 100%. Everybody I talked to said the same thing about the value of the human element, and we know it from our own use of the tools. I guess what I mean is, yeah, there's a certain cynicism to what I said. Remember, these agencies are all operating under market influences, market forces, right? And so while it comes to the creative side of it, the human will never be removed from it. But so much of the stuff that agencies have traditionally been hired for can be handled by AI. I mean, how many MLR tools did you guys see, right? I mean, that used to be the most important and one of the most important and certainly the most time intensive part of campaigns. And I saw some really impressive MLR tools that can really speed things up.
I'm curious how much data came up for you guys. I feel like one thing, like another sort of through line in what agencies were talking about and what will differentiate them from each other in the years to come is like how robust the data is that they're training these models with. Because, a bunch of them warned against just like patchwork, stacking AI workflows on top of backends or systems that don't have the data capacity to support them. And then it's sort of like useless because it only can do what you train it to do and what you inform it to do. So I'm curious as to whether data was sort of front and center as like a value proposition in your interviews as well.
It definitely came up. It mostly came up as almost like feedstock, It's like, yes, we've got good data. Yeah, but it was like everyone's got data. It's what you do with it, like you said, Bella. Mm-hmm. And I think that AI is only as good as what you feed into it. So people would be really wise to focus on the quality, like the hygiene, I think might even be the right word, of the data that they're putting into it. But yeah, it certainly came up.
Yeah, I was hearing some of that too. And it feels like a little bit like they're still in the process of figuring that out and figuring out how to make sense of all the data and use it most effectively. That was kind of like the main takeaway I had from it.
Yeah, I'm curious whether we're going to see an example. Maybe there is an example already that I just don't know about. But remember in like the really, really early days of the public launch of ChatGPT, where there was an attorney who cited case law in an argument. I think it had to do with some kind of like aviation suit, and it was hallucinated case law. It didn't actually exist, which is obviously not good to do generally. I'm curious whether there will be some, I mean, fingers crossed that nothing like that will happen in this industry. But, the hallucination aspect of these models, I think, has improved a lot. But it's kind of crazy to think about what that might look like if something just goes so awry, and then the shockwaves it'll have on the industry if it does.
Well, that's where the human comes in, right?
Yeah.
I mean,
there has to be that diligence of the human fact checking literally everything and making sure you're reading the sources that ChatGPT or these platforms provide. Because I mean, even when I use it for my own personal, stuff, doing research for articles, it hallucinates all the time.
More than the hallucinations is the fact that it can just be plain wrong so many times.
Right.
And if you know that it's wrong, I was working on something yesterday where I was looking for, I wanted specific quotes. I remembered the gist of it, but I wanted to be exactly like it was from the source. And ChatGPT said, no, it was Gemini said, no, sorry, that's, I can't find anything like that. And I said, come on.
Come on,
That's
man.
all I wrote was, come on. And it's like, oh, you're right. Yeah. Yeah. That was from 1979.
Oh my God.
So that's where the human will always come in, right?
Yeah, absolutely.
One of the other things I wrote down is a trend I noticed, because obviously this last year, there's been a lot of policy changes, a lot of like tumultuous things happening within the administration and the HHS and the FDA. And obviously like the FDA's crackdown on drug ads. And so I don't know if either of you asked your agencies about how that was impacting them. But for me, it felt like most kind of came back and said, it definitely was kind of a stressful, tumultuous year, but we still saw growth in spite of it. And we were able to kind of like navigate it and pivot quickly. There was one example where an agency was representing several smaller biotechs who had submitted applications for drug approvals to the FDA, and kind of given the FDA's year of flip-flopping on approvals, several received like complete response letters and they had to pivot. And then, in terms of like the FDA drug ad crackdown, a lot of agencies said that they weren't really impacted by it, but maybe they were just trying to not really bring it up or talk too much about it. So I'm curious if either of you heard much about that from your agencies.
Yeah, for sure. I would say probably half the agencies I spoke with brought it up unbidden. And those FDA letters actually gave agencies an opportunity to prove their worth, to be able to say to the clients like, hey, look, here's what you need to do. And also several of them had created tools that allowed them to sift through all the letters and say, here are the trends that they're jumping on, right? This is the stuff we need to be mindful of to retrofit campaigns, but also to keep in mind as we're looking forward. So, again, it was an opportunity for the agencies to prove their worth, even though the agencies were the ones that had created in the first place.
Yeah, but Madden, you wrote that mock FDA letter. I think what I heard from the agencies I talked to was that there was a little bit of a sense of like not flying by the seat of their pants, because it's not, they have contingencies, they have plans, they know how to respond to things like this. But some of the just like sheer randomness of some of the things that the FDA was accusing, like, having distracting visuals while you're talking about side effects and stuff like that. It's like, is a golden retriever distracting? Is someone smiling on screen distracting? And so that, there was a lot of just like confusion and shaking around as to like what was okay to do, what was not okay to do. And a lot of times it was more reactive, because you can't totally know what the FDA is going to send a letter. I mean, of course you can, but like there's some things that are a little bit more iffy there. But I actually hadn't heard of folks doing having tools to compile all the letters and look at sort of how to avoid those pitfalls. That's a really interesting use.
Yeah, that is interesting.
Yeah, I don't want to tip my hand because I want people to read the report when it comes out on June 9th. But there are two examples of that in my reporting.
Any other trends that either of you saw that were kind of different or interesting? You know, I have a few thoughts on like how agencies are viewing the future, but I'm curious if there are any other that kind of come top of mind for you.
Well, what do you think, Lesha? What did you hear about how they're considering the future?
Well, I guess I heard a couple of things about the GLP-1 space, because as more and more GLP-1s and sort of like obesity treatments enter the market, it's going to become an increasingly competitive space, and the marketing is going to evolve as well. Because right now, GLP-1 marketing is kind of focused on, breaking down the stigma of weight loss and using, therapies for weight loss. And it's going to move a little further into a broader thing where it focuses on personal preference. Like, do you want an injection? Do you want a daily pill? Do you want to take a different combination of things? And there's also going to be preferences when it comes to like, are there therapies to maintain muscle mass versus not? Or how can you make sure that you're eating the right things while on a GLP-1, et cetera, et cetera. So that was one of the things I heard about the future. And then another thing I heard was just like the power of this like growing social media creator economy, and how pharma companies are going to really need to start tapping into that. And agencies are going to have to start really changing how they work to better support companies to become creator companies, basically. So those are a couple ones that I wrote down that I thought were kind of interesting.
Yeah, I agree. I heard a lot about GLP-1s. I did not hear quite as much about the creator economy, but it's a really good point.
Yeah, I feel like I did a story yesterday, unrelated to A100, but about Real Chemistry's Star Power team, which has like a database of over 10,000 creators that are, anything from like can be broad health educators to like work on specific disease states and stuff like that. And I just think it's so crazy that, I think some agencies are going to be more prepared for that than others, but it does feel like, Lesha, to your point, like there was a source yesterday in that story who was like, it's no longer a nice to have, like you kind of have to, there's so much information swirling in the ecosystem, and influencers and content creators, whether they're HCPs or, patients themselves, like you gotta have someone in the ring there. And, of course, be careful about like compliance and whatnot. But it does feel like there are agencies that have like really robust, structures in place to help brands navigate that.
Yeah, for sure. All right. Well, thanks, guys, for chatting about this. Obviously, all of our listeners, thanks for listening. You'll be able to dive deep into our stories, get into a lot more of this when everything goes live on June 9th. And I think next week we're going to be doing something kind of fun for trends. We'll be trying out some of the video games that were submitted by all of your agencies for Agency 100. So tune in for that. As always, thanks for listening. Take care.
The MM+M podcast is produced by our editorial staff, Bella Jakowski, Lesha Bushek, Steve Madden, Jameson Fleming, and Jack O'Brien, with production and editing by Bill Fitzpatrick and Gordon Thaler. Listen to all episodes at mmm-online.com or wherever you get your podcasts.